This segment is sponsored in part by One Brooklyn Health.
March is Healthy Nutrition Month. Probably good timing as some of us, not naming names, have fallen off those New Year's resolutions. Not these two names.
That's not us right here. No. So our friends from One Brooklyn Health are here to debunk nutrition myths, kick fad diets to the curb, and tell you what you need to know to eat healthier.
That's right.
Thank you very much. Welcome Shivani Mohabir, Chief Dietitian from One Brooklyn Health, and Natasha Eziquiel-Shriro, a One Brooklyn Health Nutrition Educator. Ladies, it is so nice to have you here.
Thank you for having us.
100%.
Big month.
It is a big month. So let's start by talking about why nutrition is so important, because a lot of us equate how we look with what we eat with how we look, right? So what is the scale telling? Is the scale telling us the true story?
You know, that's a good question. Nutrition, as you know, is the foundation for health. Research shows leading causes of death nationally are directly linked to poor nutrition and intake. So it's really just not about eating right to look good, but eating better to live longer, healthier lives.
Yeah, I like that.
That would be lovely.
I like that.
Now, Natasha, you're a nutrition educator. What is your role in helping the people get the information that they need when it comes to eating healthier?
You know, thanks for having us here. I would like to say I just feel honored as a registered dietitian to get to really uplift the role of the nutrition educator on the medical care team. And one thing about working at One Brooklyn Health is it really is a team approach to care. Using electronic medical records, I'm able to see information about a person before they even walk into the room. Their health history, their lab results, really their care needs, so that when they do come in, we can focus on their lifestyle, their personal health goals. And from there, come up with a health plan to get them from point A to point wherever they need to be. And I provide tips and tricks and resources to help make being healthier the easier choice.
I like that.
Beautiful.
I like the holistic approach.
Yes.
So can we put you both to the work a little bit? What do we need to know about how we feed and fuel our bodies?
Great question. So as dietitians, we teach you how different foods affect the body and really how you feel. In conjunction with this year's nutrition theme, Beyond the Table, we help to guide clients better on how to read food labels, knowing what ingredients are in those products, really how many servings are in those containers, and really visualizing what a portion size should be so that you're maximizing your nutrition benefit.
Yeah. I've had to start wearing glasses to the grocery
To read
store
the
now
labels.
because I read the label and I'm like this, but it's important to see.
It's good. And if I can't say the word of something I'm looking at, I'm
That's right.
typically like, maybe not the best. But we're gonna have them debunk some things
That's
for us
right.
in a minute. But first,
Yes.
I want to ask you, Natasha, how do you go about helping people who might not have a healthy relationship with food, who come in, or who are maybe trying to break some old habits?
Yeah, that is such a good question. And I will say for a lot of folks, when they walk into the nutrition session, that's maybe their first time really talking about their relationship with food, and a lot of things come up. People talk about the obstacles they're facing, their barriers, but people also share things that they love and their strengths. And that's what I really like to try to help people build off of. We can really start to rewire the way we think about our food and that relationship by focusing on the positive and get that reinforcement that healthy changes do work, especially if we take those small steps to get there.
Right. It doesn't take just one day. It takes repeated, it takes consistency. Shivani, when someone comes into One Brooklyn Health for a consultation, what kind of information are they leaving with?
In creating your action plan and interventions to help you meet your goals at OBH, our dietitians take a number of factors into consideration. What are your ideal calories? What are your dietary needs? What food preferences you may have, and are there any dietary restrictions or food allergy? And importantly, what's your budget? Some of our dietitians help you create meal samples and recipes that are culturally appropriate and are healthy, so that you're not really giving up the foods that you love and the flavor and its texture, but you're really enjoying them in a more health-conscious manner.
Right. I like that.
That's a good approach.
It is.
I could get behind that.
Me too.
Now, you both have told us that you're registered dietitians. So we thought that you might be able to share with us one nutrition myth that we can just debunk right here, right now.
Yeah.
I think for me, and seeing a lot of clients today, the notion of carbohydrates are bad. They're not your friends. A lot of people believe that not consuming carbs can prevent you from having diseases such as obesity and diabetes and enhance weight loss, when in fact this is not necessarily true. Carbohydrates are our fuel source. It helps in its protein-sparing mechanism, so you're not muscle breaking down. And it also aids in fat metabolism. So it has a lot of important functions. I think what we need to be more conscious and spread the message as what type of carbs are we eating, how much of it we're eating, and really how we're distributing it throughout the day. After all, we are food enthusiasts. We love food. Food should bring you comfort, and it should make you happy.
Yeah.
And food should nourish the body. Food is medicine.
Shivani, I love that answer. Thank you so much. You know, the myth I'd like to debunk today is this whole idea that healthy eating is so expensive. For one, there are a lot of affordable pantry staples, beans, whole grains, that we can fit into our budget pretty easily. Upgrading our favorite family foods with healthy cooking methods definitely helps. And if you're someone like me who likes to grow their own food, a kitchen windowsill, a fire escape, or a community garden could be a way to make healthy food way more affordable and in reach.
Hear, hear. I like it. Ladies, thank you so much for being here and
Thank you for
sharing
having
all
us.
this wonderful and important knowledge. And at home, don't forget that you can scan the QR code to learn more about the great nutrition programs offered at One Brooklyn Health.